Thank you, Tom. So we're going to keep the conversation going. Next up is surprising communication secrets, how to influence employees to take action with Jesse Lahey, co-founder and strategic partner at Workforce Communication. He'll be discussing science-based communication principles and practical tips based on behavioral economics. So please help me welcome Jesse.
Thank you, Bridget. Well, to get us started, I'm gonna share 3 communication secrets to help influence employees to take action. And the first one is to move off of Tom's picture because that's not helping us at all. What? Sorry. To introduce the first secret, I would like to play a little game that I call Name That Tap. I'm gonna tap out a tune, and I'd like to see if you can guess what tune it is. Happy birthday, dear Billy. Very good. Easy, right? Okay, I would like everybody to please think of a tune that you could tap out like that you think would be pretty easy for someone else to guess. Do you have one in your head? All right, I'd like to take just 1 minute right now and find someone near you, 1 or 2 people near you, and take turns tapping that out. Just take 30 seconds each here and see if they can guess your tune. All right, 30 seconds left. If you haven't switched places, go ahead. All right, everybody get a chance to try? If you successfully guessed somebody's song, raise your hand. If you successfully guessed it. 2, 3, okay, so a smattering, 5 people. Scientists have actually studied this exact scenario, believe it or not. I would have thought scientists would have better things to do, but they studied this exact scenario. And when they've asked people to think of a tune and then asked them, just guess what's your prediction as to how often people will be able to guess your tune? The typical response was 50%. Half the time people will be able to guess my tune. The actual results are pretty much kind of similar to what we had here, only 2.5%. What's going on here, and what does that have to do with communication? Well, when the tapper taps, they have a very difficult time not hearing the tune in their own head. I mean, I'm just like, it's so obvious. Meanwhile, the listener is just hearing some kind of bizarre Morse code. So when you're the tapper, you just have this knowledge. It's already in your head what the tune is. And in a way, that's cursing us. And so it becomes very impossible to imagine what it's like to be the other person. This is a phenomenon known as the curse of knowledge. And it was the main point of the best-selling book, Made to Stick. Lots of research shows that when we are at an expert level in something, that it's very difficult to remember what it's like to be the other person, to be outside that level of knowledge. As a result, we become lousy communicators. And here's the great cruelty of the curse of knowledge. The better we are in our field of expertise, the more unnatural it is for us to communicate to people outside that field. I hate to be the one to break it to you, but healthcare and benefits is definitely a field where this is true. I've been helping benefits leaders and chief HR officers for more than 20 years to communicate, and the curse of knowledge definitely gets in the way, whether you're talking to frontline employees or the C-suite or the boardroom. All these people that you're trying to influence, your curse of knowledge gets in the way. But notice I had said it becomes more unnatural, not impossible. So let me share a story to explain this. The benefits team at a large company had put together a pretty cool program of care coordination services. It was a custom program that was kind of like disease management and large case management put together. The problem was they couldn't get employees to use it, and they really couldn't get the leaders of the company to support it and promote it to their employees. So almost no one was taking advantage of it. Now, the benefit leaders did their best to come armed with all the facts and figures and logic and data. For example, this program is for people who have chronic or complex conditions. It makes up less than 5% of the population, but these people are using up well over 50% of the company's healthcare dollars. Also, an awful lot of those dollars are not actually contributing to anybody's well-being. They're not helping them get healthier. They're not improving their quality of life. Much of it is just getting wasted. Things like excessive ER visits, hospital readmissions due to poor follow-up care, and just a lack of coordinated approach. So on and on with all these data supporting why this program is important, how it could change your life. I already have people like glazing over even right now as I'm trying to describe it. What people heard was blah, 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 or maybe more accurately, tap, tap, tap. So the benefits leaders tried a different approach based on storytelling. One of the things they did in this new storytelling approach is we helped them create some videos, a lot like the ones Tom shared, where we told stories about people who were using this program. And so we meet some of them telling their story, what it was like before they had care coordination, what it was like now. We meet some of the care coordination nurses and we find out, well, these are really nice people and they passionately care about the patients that they're helping. We meet this guy whose nickname is Ace. We hear about he had this heart problem. It kept him so much in and out of hospitals, bedridden at home a lot. Let's see, okay. And now, though, fast forward, he's able to get his life back. We meet a young girl, hear about a young girl who has diabetes, and how she had not been able to do normal teenage things because she and her mother, their day-to-day existence revolved around ER visits and doctors and hospitals and all that kind of thing. For years, that's how it had been. And now, because they were willing to just start to engage with a care coordination nurse, life is so much better for them. And we get to see them talking to the nurses and just see that, wow, this can really make a difference in my life. When these videos and other storytelling tactics were used with employees and with leaders, the first impression was always something like, wow, I never realized that. I didn't know that. And then they were motivated to find out more and to go ahead and start accepting the phone call if they got called by a care coordination nurse and meet with these people. So, I'm just like giving away all my stuff right up front. So storytelling is a great way to avoid this curse of knowledge. And it works whether you use video, it works if you're in face-to-face or some other form of communication. I've actually just been using storytelling right now just to demonstrate how we did it. It helps you avoid the curse of knowledge because it gets you out of that expert mode and puts you in the mindset of a real-life person who doesn't know so much. It also is powerful because it creates an emotional connection. And science shows that when we create an emotional connection, people are much more likely to pay attention and to take action. The story inspires them to act. And then the third thing, I just keep fidgeting with this clicker. There we go. The third thing is that it simulates how to act. So we don't just inspire them, we actually show them how to do it. Well, all you have to do is talk to the care coordination nurse, and she's nice, she's not going to bite, she's going to learn your whole story, get your information, and if you're willing, she will talk to your doctor and your pharmacist and your specialist. She's not going to get in the way or slow things down, she's going to help just coordinate things that typically don't get coordinated, that typically don't have any kind of an integrated approach. So the first communication secret is beware of the curse of knowledge and take advantage of storytelling to avoid it. The second thing is about using visuals effectively. About 65% of the population are visual learners. How many here would consider yourself a visual learner? I know I totally am. I hate it when someone tries to explain something to me and can you like draw that? Because I just am not following you. But it's not just that we're learn better visually. We actually, it influences us to take action through visuals. There's 5 reasons why the right visuals are very important in influencing people to take action. And I'll just tell you right up front, this has been very effective with advertising. You're probably aware that advertisers use visuals all the time to get us to buy their stuff. That's evidence of how it influences us to take action. So it's not just learning, it's actual action. This is, I feel like this is moving on its own. Okay, so the first reason is it causes people to notice the communication in the first place. And part of that is because people can read only 200 to 300 words per minute, but it takes less than a second to process an image. And neuroscience research shows that, or eye tracking research shows that people's eyes gravitate immediately toward an image. So it's always the first thing that they're going to look at. Okay, secondly, is it causes people to believe what you're going to say more. You have greater level of credibility. I think this is like wants me to talk faster so I get done sooner. Maybe that's what's going on. So Groucho Marx said, who are you going to believe, me or your own eyes? That much more than logic and facts, people will believe what they see. Now, I always recommend telling the truth, but studies show that people will believe even a lie if it's backed up with an appropriate image. This is not true. Don't go home and start telling people that the liquid inside a thermometer is magnesium. It's not. Anybody know what it is, by the way? Mercury. Okay, good. Just wanted to make sure we had a basic intelligence level here. But when they test this statement with people, they find out that they will believe it much more often if it's using a visual. So let's maybe use visuals when we communicate actual helpful stuff. And then the third reason is that visuals help people to remember what we say. So they're going to put it into action if they can actually remember it a bit more. And the fourth is share. For example, on Facebook, if there's a photo that you put on Facebook, it's 7 times more likely to be shared with other people. And 10 times more likely it's 7 times more likely to get liked and 10 times more likely to be shared than just text or links. So, and the last thing I just wanted to point out was they're more likely to act on it. One thing I do want to say as far as noticing it, I wanted to say is that images with people in them, MIT neuroscience research shows that images with people in them are the most likely to get noticed. That's what people's eyes gravitate toward first. Okay, I guess I'm going to go ahead and talk about infographics. Infographics are a great way to use visuals, especially in healthcare and benefits type information, because they take what can be a complex topic and make it fun, more easily digestible, put it into bite-sized, snackable chunks of information. It can take something that's boring and make it more interesting. And did you know that high-quality infographics are 30 times more likely to be read than text alone? And did you further know that nearly everybody in this room has already finished reading this slide? And if I were to keep reading it to you, which I'm not going to do, but you'd get bored and impatient and maybe throw tomatoes at me. That's because your brains can process images a lot faster than I can speak on this information. Here is an example of an infographic that we did specifically about healthcare. We did, this was for MTD Products, which is a manufacturer based here in Cleveland. They make lawnmowers and snowblowers and other outdoor power equipment. And we were helping them educate people on their consumer-driven health plan with health savings account. They have 3 medical options, and hardly anybody had so far in previous years enrolled in the CDHP. So we were breaking down, why that is, and just one is just it can be a complicated topic. So an infographic really helped make it more simple, make it more fun, make it more engaging to even pay attention and consider this. We did this type of infographic, and then we also did this other type of infographic, also for MTD, about their consumer-driven health plan. So the first was designed just to simplify the concept. The second was designed to overcome an objection that we realized that your typical employee there had, which was that, well, this HSA and consumer-driven health plan, that sounds like, it seems like it would be good for maybe, I don't know, young people who don't have much health care and no family, but it certainly wouldn't be helpful for someone that has a family and a lot of health care. So what we did is we ran some numbers with some different scenarios, including, hey, a family who uses a lot of health care. And we showed them what is the total price tag for the employee with that, in that scenario. So we compared it with their other three options. The total price tag includes their employee premiums and their out-of-pocket costs. And we said, okay, in this example, we'll run numbers based on if it's a family, they have 20 office visits and plus another 25 grand in health care expenses over the course of the year. And they get 7 prescriptions a month. So a decent amount of health care. And people were quite surprised to find out that with that plan design, that would save the typical employee in that scenario $4,000 a year. So it's really hard to get employees' head around that, but if you put it in a visual format like that, they got it. They understood the high points. So the two of those together, making it simple and then overcoming objections, made a big difference in the number of people who seriously considered and went ahead and migrated over to the HSA plan. So I've showed 3 different kinds of infographics. Of course, there's lots of other ways to use visuals. The point is not use infographics. The point is make sure you're figuring out some way to use visuals effectively, because they really do make a big difference in influencing people to take action. So lots of other kinds of ways to use visuals there. So we've talked about storytelling. We've talked about using visuals effectively. And the last topic comes from the field of behavioral economics. That's the study of how people make or fail to make decisions. I'll give you an example of the kind of thing that behavioral economics studies. So let's say you and I went out to lunch today, and I have this really good intention. I'm going to have a healthy salad for lunch. But then you order first. The waiter asks you first, what do you want? And you say burger and fries. It's a very likely possibility that I will be weak and go ahead and yeah, burger and fries sounds really good. And how about a chocolate shake too on top of that? And behavioral economics scientists have found that that's very common. People may have the right information, they may have even the right intention, but in the moment of truth, it really doesn't matter what you believe or want to do. When you're actually ordering, that's the moment of truth. And people often make an unhealthy or unwise decision. So they're trying to figure out, how do leaders help people make healthier, smarter decisions in that moment of truth? And one thing they discovered lots of cool things that are fun to put into practice, but one of the cool things they found out is that words matter. Surprise, who knew? That specific words we use can be all the difference in the world in terms of whether someone actually takes action that we would like them to do. And so it's important for us to plan our words carefully. There's a few suggestions I have for how to do that. First of all, map your key messages out in advance. And to do that, there's a tool I recommend called the 133 message map. The idea is that you start with crystallizing one core idea or outcome. Then you have up to 3 key messages. And then for each of those key messages, you have up to 3 supporting elements. So for example, for this part of my presentation, my core idea is that this 133 message map is a handy tool to help you communicate with impact, to actually influence people to take action based on your communication. My 3 key messages are that the message map can help you be clear, it can help you be memorable, and it's quick. Then you come up with these supporting elements. Now the supporting elements, they can be things like data, facts, surprising information, or I don't know, you could follow what we've been talking about so far and use storytelling or visuals. So my example here is that it helps you be clear because you end up communicating clearly helps you come across as more confident. Not only that, it helps people because it looks like you know what you're talking about, unlike what I'm doing right now because I'm stammering. But also, the people hearing you are going to have a greater amount of confidence that they actually understand enough of what you're talking about to take action. So you're organizing this way, it's going to come across as clear and confident, and it'll influence them to take action. Secondly, it's brief. Science shows that the briefer we are, the more people believe us, and the more likely they are to take action as a result. Flies in the face of the curse of knowledge, right? As we become experts, we're armed with all this information and we just want to dump it on people. But brevity actually is more clear and it causes people to act. Thank you. And then finally, actually mapping out your message and having a platform of key messages helps you be consistent, you and the other leaders in your organization, so that people are hearing the same things. If they hear the same things, they're more likely to believe it, they're more likely to remember it, they're more likely to take action. It also helps you be memorable. That's because it's all, as you didn't notice, it's based on threes. And when you group things in threes, it makes it easy to remember. So does anybody remember what Tom's 3 points were? It was captivate, educate, and activate, right? It makes it a lot easier when there's only 3. Yeah, you can pay me later for reinforcing. So this is no secret. People have been using this for years, and it just makes it easy. If I say life, liberty, everybody will fill in the blank with the pursuit of happiness. Blood, sweat, and tears, the good, the bad, the ugly. It's not only easy to remember, it's actually fun. There's just something about it, 3 being magical. And then the last thing is it's quick. A lot of the communication strategy stuff always feels onerous, but a message map, you can even do it when you're put on the spot and you don't have a lot of lead time to communicate, and you just need to organize your thoughts on the spot. You can do it in your head, on the back of a piece of paper. It's quick. And I left the last one blank because I want to just point out you don't have to have all 3 in all these categories. It's just that you generally don't want to exceed the 1-3-3 format, or you start to lose some of those benefits. Now, when you use the message map, what you end up with is not the communication itself. It's the platform of key messages that's going to go into the communication that you do. So, for example, this was at Harley-Davidson, and this was the top 3 messages from the message map that we helped Andrea, the Director of Talent Management, create. And she then was able to use these and go enroll the rest of senior leadership to all be on the same page and be saying the same thing. And this is a quote from her. She talked about how powerful it was to learn to do this intentionally up front and to get the whole team aligned on that, and just how much of a difference that made. Once we have sort of these messages kind of organized, we kind of like, okay, here's basically what I want to say to people. Then we still are keeping in mind that words matter. So we want to refine the words to make sure we're using ones that actually work. We know what the content's going to be, but what specific words are we going to use? So after we've mapped the key message, then we want to create a helpful mental frame. And behavioral economics says that the way it's best to do that based on things that people already know or care about. I'll share a few examples of what I mean here. And to make the point easier to come across, I'm going to start with a non-healthcare example. I'm going to talk about puppies. Oh, so cute. Which would you be more likely to donate money to? Supporting a local animal shelter or saving a homeless pet? Saving a homeless pet. 88% of people would agree with you. PetSmart Charities was able to, actually I'm using that statistic wrong. They increased individual contributions to animal shelters by 80% by doing some behavioral economics things. The first of which was using the phrase save homeless pets instead of animal shelters. So would you like to donate money to save homeless pets? And 88% of people said yes, or 88% more money came in. What's going on here is the mental frame that people would have had in the old way, the traditional way, that fundraisers would just say, hey, would you donate money for the local animal shelter? The mental frame that people get on that is just a building. People don't care about buildings. It's impersonal. Who cares? They care about pets. They care about saving homeless pets. The mental frame there evokes family, evokes innocence. It's cute and cuddly. It doesn't evoke prescription drugs. So they made that change very effective. Okay, so yeah, let's go ahead and talk about prescription drugs. So this is a story about Express Scripts. And they were trying to increase the utilization of the mail order drug service, like many companies do. There's lots of reasons why mail order can be better. It improves compliance, improves the patient's adherence to a treatment plan. They're more likely to choose generics or other low-cost drugs. And the dispensing accuracy is better. At the local retail pharmacy, there's lots of dispensing errors that happen. It's less automated, I guess. So Express Scripts was trying to scientifically figure out how can we get more people to use mail order service. Well, they thought about this mental frame issue, and mail order service, the traditional term that companies use, what's the mental frame there? Well, you think of like the Sears Roebuck catalog or something. That seems like a slow, kind of risky way to get something as important as healthcare. Home delivery service, on the other hand, the mental frame there is like, oh, I'm getting something exciting. I'm getting something helpful. I'm getting something useful, high quality, high touch. So a much more powerful mental frame. This caused 85% of, when they tested this, 85% of people went ahead and switched to the home delivery service, and 93% of people chose generics. So very highly effective results from that. There was a mental frame thing going on in the earlier story I told about care coordination service. We purposely didn't call it disease management. We didn't call it large case management or anything like that. The mental frame there would have been like some kind of bureaucratic caseworker who's going to like slow down your health care, maybe overrule what your doctor says, get in between you and your doctor. So we specifically called it care coordination services, maybe not the most sexiest name in the world, but we wanted people to know that we care about you as a person, that we're not about slowing down or getting in the way of your care. We're just about helping you and your existing doctor. We're just going to kind of help coordinate things that traditionally aren't coordinated. And we are going to, and it's a service. It's a value-added benefit for you. And it's a nice employee benefit addition. So the mental frame, remember, is just about connecting something to people, connecting it to what they already know and care about. They're more likely to buy into what you're promoting, more likely to take the action that you're suggesting. Then the last thing we do is we carefully choose branding, metaphors, headlines, and action prompts, and so forth, based on what works. So I'll give you an example. This was where we were helping get more employees to take their annual biometric screening. First thing we did is we didn't call it a biometric screening because that sounds kind of scary, invasive, at least it sounds boring. And we call it a health check, which isn't maybe exciting, but we were emphasizing it's quick and easy. And at least they could remember what it was called. Secondly, we took advantage of a behavioral economics concept called loss aversion, which people hate losing things even more than they like winning things. So if I told you, hey, if you go do these 3 things, you'll get $100. Most people will not actually go very far out of their way to do that. But if I said, hey, I think there was a $100 bill sitting outside your car in the parking garage, did that fall out of your wallet? Most people will waste plenty of time to go get $100 that they already had. They hate to lose things. So the messaging here was about pointing out what people could lose, how loved ones might be negatively affected if they didn't do this, and so forth. And so we asked them to suggest that they think about things that they might miss in their life if they're not there. It's hard to be there for your daughter's wedding if you're dead or if you're bedridden. And the last example I'll show is another one from MTD Products, and then I'll wrap up here, is that benefits in healthcare can be really complicated. And when it's overly complicated, employees tend to think that it is not very good. It's low value, like too complex? Well, it must not be very good. So with MTD, we purposely picked simple branding, simple graphics. We also created this mobile microsite so that people could see just real in one cohesive package all their benefits and click real easily with their thumb and go to get benefit resources. And by the way, mobile is the #1 way that people use the internet anymore. So when you make an easy mobile resource like that, you can also do things like send text to people and, hey, take this action. So there's lots of great ways to use action prompts and so forth when you're making things mobile. So we talked about storytelling. We talked about using visuals effectively and using words effectively. My name is Jesse Lahey. My company is Workforce Communication. You can find out more about us at workforcecommunication.com. And if you want to email me, I can send you that Word document template with the expanded message map for you. But thank you very much. Good to get to know you all.